So, hi and welcome to Care to Translate's webinar. My name is Charlotte and I work as a Customer Success Manager at Care to Translate. Today we're going to discuss language barriers together with Kjetil Bjørdal, who is working as an intensive care nurse at Ålesund Emergency Department in Norway. Kjetil and his team has been using Care to Translate for more than 1.5 years, so it's super fun to have Kjetil with us today. So the agenda, we will start with an introduction of Care to Translate, held by Maja Magnusson, our CEO. She will also have a short demo of our tool. And she will also tell you a little bit more about the special offer that we got for you today, which actually includes a free trial of Care to Translate. After Maja's intro, it's time for Kjetil to do his presentation, which we are looking forward to. And we will end this webinar with a Q&A session. So before Maja starts, I would like to encourage you to ask questions. You can please write them in the Q&A section at the top or in the chat, or save until the end of the session so we can put your microphones on. So, varsågod Maja.
Thank you, Charlie. Hi, my name is Maja. I'm the CEO of Care to Translate, and I'm really excited to see so many joining us today from various countries. I want to take the opportunity to tell you a bit more about Care to Translate, just in case you haven't had the opportunity to try the app yourself. And so basically what you get is a medical verified translator that can be used by healthcare staff that meet patients who do not speak the same language. You can use the app on your phone, on a tablet, but also in your desktop, on your computer. Since it's a digital tool, it's available 24/7, and you can translate from and to 45 languages. All the content is verified by native speakers with medical expertise. And you can use the tool throughout the entire patient journey, which helps you to inform and register the patient when you first meet them. You can ask important questions and also talk and instruct the patient during the examination. An important factor is also it can help calm the patient, and you can give important information to the patient once the appointment is over and you want to prepare them for the next appointment. And to tailor the content to your special needs, you can set up different kind of templates for different dialogues, depending on where you work in the healthcare sector, but also depending on your role. And these templates are ready and available for you. These can be tailored based on your certain needs and also shared with your entire department, which ensures that you can inform and communicate in a standardized way with all your patients, no matter what language they speak. And I want to give you a quick intro to our app so you can see how it actually works. And I will share a demo from my desktop where you can see how it looks when you enter the app. In this case, we will demo a account that is suited and tailored for an emergency department. The blue icons are different playlists, and if I enter one of these, for example, the nurse examination playlist, I will see a playlist that shows different kind of phrases containing information, important questions, or instructions to the patient. To translate, I click on the phrase that I would like to select. And the translation is played in text and sound. To change the language, I simply use the language icon, and I can scroll and choose between the 45 different languages that we have available. So let's try, for example, German. Some languages are different depending on how you speak with a person who identifies as a male or as a female. So in this case, I would have to choose. And after, I'm back in the same list and I can translate the same phrase, but to a German-speaking patient.
Bitte legen Sie sich hin.
So this is basically how I use the app. I have the dialogues ready for my department, but if I would need to talk about something new, maybe I need to search for a phrase, I can use the search function and search for example, pain or maybe pain scale that could be relevant to ask the question how much pain they have. And here I can translate direct from this list as well.
Auf einer Skala von 0 bis 10, wo 0 überhaupt kein Schmerz und 10 der schlimmstmögliche Schmerz ist, wie sehr tut es weh? Zeigen Sie die Zahl mit Ihren Fingern.
And of course, you will always have access to all the phrases that Care to Translate provides. If you scroll down a bit, you can see the entire phrase library that we have divided into different areas. And here, for example, the area background could be relevant to you as well. So this gives you some inspiration, what kind of phrases you could add to your playlist that you can customize for your team and your department. And this was the demo I wanted to show you. And for everyone joining us today, we also have a special offer for you where you can try Care to Translate in your department for 3 months. You will get a €300 discount on the regular price, and you will also receive a report that shows how much usage you've had and what kind of positive effects you might gain from the app. For example, reduce time for your staff or also reduce costs. So this is for you special today. And if you're interested to hearing more about this, please contact us. And now I'm handing over to Charlie.
Yes, thank you, Maja. And yeah, just a reminder before Kjetil, again, please ask questions in the chat or raise your hand by the end of his session, and we will go through them all. So now it's time for Kjetil. So please take over the screen whenever you're ready.
Hi, my name is Kjetil Bjørdal. I'm an intensive care nurse with the ER department of Ålesund Hospital in Norway. I'm going to talk a little bit about our experience in the ER setting with Care to Translate. In a Norwegian scale, our hospital is about medium sized. We have around about 17,000 patients through our ER per year. We are located in a coastal area with about 148,000 inhabitants. In addition to those 148,000, we have a large amount of foreign workers in construction and maritime industry. Most of these workers come from Poland, Lithuania, Latvia with very poor English skills. And unfortunately, they are highly overrepresented in injury statistics. From the middle of last year, we started also receiving medevac patients from Ukraine. We are currently the hospital in Norway that has received the highest amount of medevac patients for cancer treatments in Norway. Before we started using Care to Translate, we had agreements with 4 different companies surrounding phone interpretation companies, and this would work like we call a command center, and they would find an available interpreter for us and appoint us to a number to call at a given time. Although we had those 4 companies standing by for us, we had monthly basis translations and challenges. We would experience that the interpreter we called would speak worse English or Norwegian than the patient himself, which decreased the quality of communication and increased the insecurity in the communication. We several times every month would experience that the interpreter didn't answer the phone at the agreed appointments. But when we checked, we would see that we would still be charged for the service that we were not given. Arranging a phone interpreter for us is a process that takes a lot of time and resources to arrange and synchronize. We need an available examination room with a speakerphone, and we need the doctor, the nurse, the patient, and the interpreter available at the same time within that room. which proves difficult every single time in our busy ER. This is also a very costly service. It costs us around about 1,500 euros per month to use phone interpreters. That's in our emergency and operation department alone. And we are a relatively big hospital. So we're talking several 100,000 euros within the hospital itself per year. In desperation of trying to communicate with patients in the ER, we have in non-emergency settings tried to using Google Translate over the years. Our experience with Google Translate is that we experienced insecure patients. It was obvious that they didn't understand the interpretation we tried to transfer to them, and we had no idea what was actually translated. For all I know, when I tried asking the patient to take off his pants, I was probably asking him to jump out the window and run for it. I don't know. And there's no way that way I could quality check that the translation was correct. Many of our intern doctors has studied abroad, like Bulgaria, and they brought back various types of apps with voice-to-voice translations. Our IT security department did not approve of the use of those for two reasons. One, we have no quality check that the translation is correct, and two, the voices that are recorded on these apps are stored on foreign databases, which is not according to Norwegian legislation concerning patient confidentiality, because we do not know who can use their voices and misuse their voices after it's been recorded. I applied for and received project funds to run a project in the four of the ERs and our 4 county hospitals. There are 4 hospitals in my area where we are the largest one. We found Kjetil Translate very easy to use. We started with the free version while we were waiting for the paperwork and permissions. We learned it in like 5 minutes, start using it. But the experience is that it requires some training to learn the order of the playlist to avoid searching and creating better flow in the conversation. So when I got the thumb up, I spent around about 15 hours building the nurses playlist according to my need, the way I used to examine the patient. So I will get a good flow through the examination without the need of flipping up and down, searching for the correct playlist or sentence. I also had a doctor on board in the project that spent 1.5 days building the doctor's playlists. The rumor spread around the house that we could interpret anything, anytime, which made us able to try the app in various settings around the hospital, not only the ER setting. So we would walk around the hospital and try the setting if in a bed ward, like if we just need a urine sample, we can go in, play the sentence and go out again with the urine sample without the need of having to call a phone interpreter every single time for every single small thing that we need to do. Unfortunately, the project itself was cut short because there was a national procurement on the way, where Kjetil Translate won the procurement agreement, and we now have an agreement with them. In the process, what we gained is a peace of mind, because we now know that every sentence we read to the patient is read by bilingual medical staff and thereby qualified. Good quality translation is it's good enough for us. We know it's correct translation. We gained also the benefits of having the interpreter in my hand as the patient walks in the door. We don't have to synchronize and arrange a lot of people and rooms to start translating. We were told when the national procurement was over that this was only supposed to be an addition to the phone interpreter, but quite honestly, here in Ålesund, the Kjetil Translate app met our needs so well that we totally replaced phone translation with the app. Our doctors in the ER also reported that they were very satisfied with being able to just keep the focus on the actual case, on the current issue, without having to hear the life stories about themselves, their aunts and their grandparents and everything. And they also reported that they felt more efficient examination on a foreign-speaking patient with Care to Translate than the examination of Norwegian-speaking patients. Of course, also we could take down the costs of translation with huge amounts of money. One example I want to take out is a Lithuanian trauma patient. This guy fell down about 8 meters and landed on concrete, was reported as a trauma patient, and is taken into a trauma room with 13 healthcare professionals. This is a large room, a lot of people, some noise will always be. It's not suitable for speakerphone translation. When time is of an essence, we need to execute this examination here and now. So we can't use any time waiting for an available phone interpreter. So the solution in this situation is that I put myself at the head end of the examination table with Care to Translate on my iPad. I was ready to interpret within 2 seconds after the patient arrived. And I managed to guide the patient through the entire trauma examination, and he felt confident being taken care of by the fact that he was able to follow the examination, because I explained to him with Care to Translate what was going to happen next. Another very good example of the good thing of having Care to Translate in hand is this was winter time. The primary doctor's office called us and said they're sending over a COVID positive Syrian refugee with an infant for admission. At that time, it was -3 degrees Celsius outside and very strong winds, high danger of hypothermia. The patient presented herself at our door 3 minutes after the doctor had reported her to us with her husband. Neither of them speak any Western languages. And I had to run back in, get the iPad to start translating and speaking and communicating with them. Because of the COVID restriction at the time, the husband was not permitted to enter the hospital, and I could not leave the patient outside there with the infant until a phone interpreter was available. But with the Care to Translate on iPad, it took me about 30 seconds to run back in, get it, start up the iPad, and start to communicate with the patient and her husband. And the Care to Translate app made me able to send the husband back home with information to stay home in case he was infectious. I was able to tell the patient herself to follow me up to the ward, directly into our isolation room, where I stood and informed the patient about the routines around isolation. All this in Arabic. She understood everything that was said. She nodded and confirmed that she had understood everything that was said. About Care to Translate as a company. This is a company that initially promised us that languages we needed could be provided within 6 weeks. This they proved right when Russia attacked Ukraine. When Russia attacked Ukraine and we started getting Ukrainian refugees, Ukrainian language wasn't in their library, but they delivered within 6 weeks the first playlists in Ukrainian, although some of their interpreters were stuck in war zones in Ukraine, which is very impressive. They deliver what we need with good quality. And that was the end of my presentation. Thank you.
Perfect. Thank you so much, Kjetil. It was really interesting to hear your presentation. And now it's time for questions. I can see that we got some in the chat already. And if you have any questions that you want to say out loud, please just raise your hand. We got one question from Rachel. Do you need Wi-Fi to use the app, or is this a stock of playlists? Yeah, you don't need, most of our users have Wi-Fi, but you can always download a language to the app so that you can use it without. And then you download the whole language, so you can download as many as you want. And we got one question from Adam. Are you using any other devices than iPad in the ER? Yeah, that is a question for you, Kjetil.
Yes, we use the iPads because that's what's available. It's transportable. We can just as well log on to our computers within the patient rooms, or we can use our phones. But right now, Norway is about to launch a new software, which means one patient has one journal whether it's the primary healthcare or specialist healthcare that opens it. It's one same journal. And within this, there was a smartphone, a secure smartphone that was supposed to be used for this project as well. However, they couldn't deliver smartphones that actually worked. So we had to use the iPads. But you can use iPads, smartphones, computers, anything.
Perfect. Yes, we got a question from Gudrun. Did you receive help from the department manager to get the whole team with you on this, or did you do it all by yourself? Yeah, so how did you work with the implementation?
Well, the implementation itself was actually the most caused me most problems, because this was project funds, which meant I had to put together a project group. When they gave me the project funds, I thought, yep, I got the money, I'm going to buy it today, I'm going to start using it tomorrow. But because this was a project, I suddenly got a phone from some guy that said, I'm your project coordinator. I didn't know who he was, but he stalled me for several months. And for several months, I was waiting for permission to start using it. Because before we could implement this securely, because we saw the bigger picture here, we wanted to run proper risk analysis. Could this software be used to integrate into our journal systems and get information from our journal systems? So there was a lot of examinations about the security of using this application. But as soon as these things were in hand and we got a thumb up, we just started using it without any problems at all.
Great. And another question from Katrine. Can the patient also respond? Does the app do voice translation, or should the patient also choose from a selection of options on the app? Do you want to answer that, Kjetil?
Yeah, I can take that. The Kjetil Translate application does not use voice-to-voice translations. If they used voice-to-voice, they would not pass our security check because we don't know where the voice would be stored. But the patient himself, we use two iPads because we got one iPad on healthcare setting and one iPad with patient setting. The patient's version is somewhat easier and is built up for the patient easily to explain to us what's wrong with them. So the patient himself can use the Kjetil Translate, their version, to explain to us what's the problem, and we will get the translation in Norwegian. So yes, the patient can use it and we can use it. So we can use it together to communicate both ways.
Can I also add just one more functionality, because that is a really great scenario that you're explaining. And then we've also thought about the scenario where maybe the patient is not capable of administering an app. So then you have the possibility to instruct the patient, please nod for yes and shake your head for no, for example. And then when you ask questions, they can answer with body language, or you can ask them, please point where you have pain, or how many days have you had the symptoms? Please show me with your fingers. So there is also the option for the patient to answer with body language.
Perfect. There's one question, pre-hospital experience.
The idea of using Kjetil Translate actually originated from pre-hospital ambulances, because some of the ambulance workers has been trying to find out how to communicate with patients as early as possible. One of the gains here will be that the sooner you can communicate effectively with the patient, the sooner you can determine where to drive the patient. Can you drive this patient to his regular doctor, or does he need to be driven to the hospital? So the idea came from them. Yes, they used the free version of CTC at that time, and they had some experience with it, and that's where the idea came from when I started this project.
Thank you. There's one question here from Åsa. What have been the reactions from your colleagues when introducing the app?
They were very excited, because the experience we had with using phone interpreters has been so bad. We know getting foreign speaking patient, it takes a lot of resources. We don't have that time anymore. Our patient database has been increasing by 7 to 10% every single year for the last 5 years without the staffing being followed or matched. So the days are being more and more busy, and we need every second of the day. So when the foreign speaking patient comes in the door, we know we got to synchronize, we got to get a phone interpreter, we got to get a room, we got to get the doctor. It takes a lot of time. Using the Care to Translate, they are very relieved to have it in hand, and they use it actively.
Yes. From Annie, is Care to Translate also used by ambulance staff before coming to your ER? Is that instead of help, would it be of help for you to have more info on the patient upon arrival? Sorry.
Some of the ambulance workers use it on their private phones using the free version, yes, and they have been for several years. The idea with the project was to broaden it, not just to the ERs, but also include some ambulances to gain some experiences from ambulance service with using the Care to Translate and document it. But unfortunately, because of the national procurement, I had to shut short the entire project, so I didn't get there yet. But they do use it. They can use it. We even tested it into the equipment in the ambulance, so they wouldn't have to use their own personal phones to use it, and it's fully compatible with the equipment in the ambulance.
Yes. Question from Sally Ann. How does the patient respond? Do they click on an answer?
They can click yes. Some of the questions is like we get the possibility of answering yes or no or maybe under, so they click on what's correct for them, and we will get the translation to Norwegian.
May I ask you, Kjetil, how does the patient usually answer at your department?
The fastest way of communicating is just yes and no questions. Most of the questions is yes, is based so that the patient can answer yes or no, or showing the number of fingers to indicate something. So that's the most efficient way of communicating. Yes and no questions. So they will nod or shake their head.
Thank you.
Yeah. And the question from Therese. We use the hospital's handheld device in Trondheim. Yeah. I don't know if that was a question.
No, it's not really a question. It's the same thing that Kjetil was talking about the phones, yeah. The app on the phone. So we are using that in Trondheim now. Yeah. It's working well.
Yes, that was the plan, because the Helse platform was supposed to take over. You got it already. We're taking it from April, and the equipment there was supposed to take over the app. So it's secure for use in the Helse platform as well.
Yeah, and it's working really well with the handheld devices.
Good.
That's great to hear. From Robot, how do you assess which language or dialect the patient speaks?
Usually we get a report from the primary doctor which nationality the patient has. Sometimes we got a guess. If it's a typical Eastern European language, we can ask Latvia, Lithuania, and they will understand, because it's then just try out what works. Ruski, whatever.
Yeah, I can also add that we have listed the languages in the app on the right language, or how to say, so you can also show the different language to the patient to get a clue. So there's also one way. From Paula, are there any plans to implement this over all Norway on all type of medical buildings, lägekontoret, sjukhusen och så vidare?
Specialist healthcare has an agreement now. Primary healthcare, I don't know. There are so many different unities in the primary healthcare. One doctor's office is one unit, which is not implemented by other doctor's offices agreements. So what it's going to be like in primary healthcare, I don't know. But in specialist healthcare, there is an agreement now that can be used all over Norway.
Correct. And I just want to add to that. So that's the framework agreement that was signed, and it has been rolled out to the two big health regions, Helse Sør-Øst and Helse Midt currently. We also have customers from municipalities in Norway. So if you are from a municipality in Norway, you can get in touch with us, but then it would be a separate agreement.
Yeah, perfect. I don't know if you want to take the next one as well, Maja. How does Care to Translate handle patient information security?
Yes, of course. So the app itself, we don't store any personal data. So we don't store any patient data or user data. So that is, I think, the most important to understand. And we have also you can say an admin portal where, for example, Kjetil and team has built the list, and here you have to register to be an admin, and that data we will have, but it will never be connected to the usage of the app. So we will never know who is talking to who at what certain time. Yeah.
This was also one of the major concerns from the IT security people here in Ålesund or Helse Midt. But nobody knows who's in the room except the guys that are in the room. That can be anywhere playing anything. It's just like Spotify. You can track what playlist has been played, but there's no patient information. Nobody knows who this has been played to. So it's 100% secure.
Thank you. A question from Robot. Can the company add other languages within 6 weeks time frame? Yeah, do you want to answer, Maja? I see you smiling.
Yes, this is a typical it depends question. It will depend on what kind of language is requested, how easy it is for us to build a team around that, because we have certain ways of proofreading, also how much technical support we can have for machine translation and machine voices available. So it could be possible if it's a so-called easy language for us to implement. So if you tell me more about the languages you are looking at to implement, I could give you a better answer.
Yes, and from Catherine again, not so much of a question, but I recall a discussion years ago that having a live translator, assuming a good one, had so much benefit for the patient as they could also advocate for the patient. Do we integrate the app use with a similar mechanism for patient support. Do you want to take that question, Maja?
Yeah, I'm not really sure if I really understand correctly. Do you mean to have a machine translation integrated? Because that we do not have. We have a patient library, but that's based on the same technology that we use for healthcare staff as well. And what we also have is the possibility to add traditional interpreter services to the app, so that you could call a interpreter through the app. But we don't have any like machine translation that opens up the possibility to write or speak whatever you would like in that certain situation. Maybe I'm answering completely wrong because I don't really understand the question right now, Catherine. Would you like to explain? Please feel free to do so. Or maybe if Charlie, Kjetil understood it differently.
No,
I could.
Yeah.
Yeah. Sorry, it's kind of a tangential question, but just curious. We were at the European Migration Forum discussing health for migrants in 2019. And I remember from a Norwegian presenter from Stavanger, I think, that she was saying that one of the benefits of good live translators is that they could really speak for the patient and advocate for them in difficult situations. And I see the benefits of the app for sure. I'm just wondering, I don't know if there's any practical way that it's been integrated in the healthcare system. Do we maybe include a social worker? Or how could that work?
Okay, I understand better now. That's a really interesting question. And from our side, Care to Translate, we don't give any propositions to our customers. I don't know, Kjetil, do you have any certain processes in place for that?
In our perspective, usually if there's a next of kin that speaks Norwegian, English, and can translate, that's very good. But it challenges the some of the questions surrounding patient or our what's it called again? I can't give a patient's husband any information about the patient's health status without the patient's permission. So it raises a few questions surrounding the ethics and the legality of using a next of kin person to translate. Second best of using next of kin to translate is to have someone physically available in the room, which is not very easy. We do have some African patients around here. We actually got one phone interpreter for our language that you probably never heard of again. It's something in the middle center of Africa in the jungle, a special dialect. We managed to get an interpreter on the phone, but trying to get someone physically to advocate for the patient into the room with that language and that dialect would be practically impossible. And we also use the Care to Translate in the examination process. If we want a deeper conversation with the patient to examine what does the patient feel like and the mental issues and things like that, we would need an interpreter, either physical or on phone, in addition to Care to Translate. But in the ER setting, where we have a focused examination, this is all we need.
Thank you. All right.
Yeah, from Claire, how do you evaluate patient experience of using the app? Yeah, do you want to start, Kjetil?
Well, I use the trauma patient as an example. When he came in on the ambulance trolley, he was anxious. He was looking around. He was clearly uncomfortable, unsecure. He didn't know what was going on. But as soon as I started translating to him, explaining him that I will use the application to translate and communicate to him, he settled down and made eye contact with me and relayed to me all the time during the examination, which made him, I think he calmed down and he had a better meeting with us than he would have had if we had no translation at all, or with translation in bad English. It calms them. It's a security for them to be able to communicate. The communication is of the essence in everything we do.
I just wondered if you'd been back to any of those patients and asked them what their experience, formally asked them what their experience had been of using the app, or whether you'd had any patient views on it.
No, not formally, no. We were supposed to do that as part of the project, but we were cut short, so we didn't get to that point yet. But we did ask the patient when he was leaving the ER, did he feel comfortable with using the app? And it was clear that it was definitely a help for us and for them.
That's great. Thank you very much.
You're welcome.
Yeah, and I can also, we have had customers who worked with like short service, like placed in the waiting room and so. And we also have a phrase in the app where you can ask the patient how they experience the app. I guess you don't always have time for that, but that is also one way to ask them. Yes, let me see. Irene would like to share some experience of using Care to Translate if we have time. I see that we have only 2 minutes left, so I think we will have to focus, even though it would be interesting, Irene. We have to focus on the questions. And there's one feedback back from Ayla, who says that she used Care to Translate in pre-hospital work and wish there will be questions building on AMLS. That is something that we will take with us as feedback. Thank you. Yes. And what feature are going to be adapted in the near future based on the patient or your end user feedback survey? Is that something that you would like to answer, Maja, before we end the webinar?
Well, we will probably make it even easier for users to understand or to know what kind of phrases or dialogues that would suit them. So when you enter the app, you will be presented with a suggestion of an account that could suit you, depending on where you work and what role you have. So that is something we're looking at, of course, to make it even easier for you to get started and to have all the right information at hand.
Thank you. So now we are 1 minute. Yeah, now it's 45. So we will have to close this webinar, but we want to say thank you so much for listening in today. Thank you, Kjetil, for sharing your experience with Care to Translate, and thank you all for your engagement. Don't hesitate to contact us if you have any questions. We can answer them afterwards, or if you are interested in the special offer, of course. Thank you so much.
Thank you so much.
Thank you.